ACL surgery, when a non-surgical approach just isn't enough. You might be surprised to learn a conservative approach to an ACL tear could put you at risk of needing another surgery years down the line. I'm Dr. Sean Leo, your friendly orthopedic surgeon. I believe in giving my patients all the information they need to make the best decision for their unique life and goals. Let's find out why many athletes choose surgery. When an ACL tears, it leaves your knee without a critical stabilizer. While some people can function without it, especially if they are not active in sports, others find their knees feeling unstable during simple, everyday movements like getting out of a car or walking on uneven ground. Each time the knee buckles, it can cause secondary damage to other structures, particularly the meniscus and cartilage. Over time, this repeated damage can accelerate the onset of arthritis. If you are a young, active individual with a desire to maintain a high-impact lifestyle, a surgical approach may be necessary to protect the joint for the long term. A specialist can help you weigh your options and determine whether a conservative approach or surgical repair is the right path for your health. If stability is compromising your knee's future, a consultation with a specialist can help you understand when a surgical approach is the best way of regaining a stable and active life. Don't let short-term pain create long-term problems. Take a proactive step towards protecting your knees for the future.